Romosozumab is a monoclonal antibody used to treat osteoporosis in postmenopausal women at high risk of fracture, patients who are intolerant of other treatments, or patients who have failed other treatments. In this video, let's found. What is romosozumab? What is romosozumab used for? Contraindication. What are the side effects of taking romosozumab? How does romosozumab work? How to use romosozumab? What is romosozumab? Romosozumab, sold under the brand name Evenity, is a medication used to treat osteoporosis. It has been found to decrease the risk of fractures of the spine. Common side effects include headache, joint pain, and pain at the site of injection. The U.S. Food and Drug Administration, FDA, considers it to be a first-in-class medication. What is romosozumab used for? Romosozumab is indicated for the treatment of osteoporosis in postmenopausal women at high risk of fractures and also in patients with osteoporosis who are intolerant to other treatments or who have failed in other treatments. Contraindication. Romosozumab is contraindicated in patients with hypocalcemia, a history of stroke or myocardial infarction in the past year, or a history of hypersensitivity to romosozumab or any component of its formulation. Side effects. Common side effects include headache, joint pain, and pain at the site of injection. Pharmacodynamic. Romosozumab is a subcutaneously injected humanized monoclonal antibody that inhibits the secreted protein sclerostin. Inhibition of this protein allows WNT signaling in osteoblasts to promote bone formation and allows for the inhibition of receptor activator of nuclear factor kappa beta ligand, RANKL, mediated bone resorption by osteoclasts. Mechanism of action. Osteocytes secrete sclerostin, which inhibits bone formation by binding to low-density lipoprotein, LDL, receptor-related proteins 5 and 6 of osteoblasts, inhibiting the WNT signal pathway. Romosozumab targets and inhibits the protein sclerostin, thereby preventing inhibition of bone formation by allowing WNT to bind to LDL receptor-related proteins 5 and 6. Activation of the WNT pathways leads to downstream signaling, translocation of beta-catenin to the osteoblast nucleus where it promotes survival and proliferation of osteoblasts. Sclerostin also promotes bone resorption through increasing production of the receptor activator of nuclear factor kappa beta ligand, RANKL. Romosozumab's inhibition of sclerostin also inhibits the increase in RANKL-dependent increases in osteoclast activity and bone resorption. Both effects from the same therapy have not been seen in other osteoporosis treatments to date. Half-life: 12.8 days. Mechanism of action. Osteocytes secrete sclerostin, which inhibits bone formation by binding to low-density lipoprotein, LDL, receptor-related proteins 5 and 6 of osteoblasts, inhibiting the WNT signal pathway. Romosozumab targets and inhibits the protein sclerostin, thereby preventing inhibition of bone formation by allowing WNT to bind to LDL receptor-related proteins 5 and 6. Activation of the WNT pathways leads to downstream signaling, translocation of beta-catenin to the osteoblast nucleus where it promotes survival and proliferation of osteoblasts. Sclerostin also promotes bone resorption through increasing production of the receptor activator of nuclear factor kappa beta ligand, RANKL. Romosozumab's inhibition of sclerostin also inhibits the increase in RANKL-dependent increases in osteoclast activity and bone resorption. Both effects from the same therapy have not been seen in other osteoporosis treatments to date. Safety advice. Romosozumab is not indicated for use in women of childbearing potential or in pregnant women. There are no data from the use of romosozumab in pregnant women. That's all the information about romosozumab we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.